So I'm doing reactive neuromuscular training, and today we're going to do it on the ankle. So you do that after an injury occurs and when you want to enhance the motor control skills and restore functional stability around the joint. So for the ankle, first you are going to test the unaffected side. I'm going to pretend I did that, and so what you would do is you will show them which way you will go based on where you're touching. So when I touch here, they're going to dorsiflex on the bottom, plantar flex. Outside they're going to evert, inside they're going to invert. So once they know which direction to go based on where I'm pointing, you're going to have them close their eyes, and then they will do those motions. And you're going to do this for about 30 seconds, going in different directions, trying to test their reaction time, and this will help the peripheral nervous system be able to reestablish these pathways that are damaged during injury. So that's great, and it will get better as time goes on. So then the next one that we're going to do is impulse technique for isometric stabilization for the squat. So JT, squat for me. As you see, he comes towards me and has a muscular imbalance. So what you're going to do to help prevent that from happening is put the belt around the waist. Good. Have it around the hips for them. And so since he made this motion, I'm going to pull in this direction, which will counteract and make them have to go into a proper squat form. So squat for me. And as you can see, this helps them have proper function mechanics of the squat. So yeah. Okay, so this is a vastus lateralis tape technique that is going to inhibit the muscle, and so you do that to help the VMO fire at a similar pace. So the VL is a fast twitch muscle, which means that it fires quicker. Now it's a millisecond difference, but fires quicker than the VMO. So when we need to help the VMO get a better contraction, you inhibit the VL, hoping to help facilitate that. So the first thing I'm going to do is have them contract their quad. Okay, you can relax. And then you put the coverall on the area, and this helps prevent skin reactions. It just protects the skin a little bit because Leuko tape can be a pretty harsh tape. And everyone reacts differently. So we're using 2 pieces, and we're going to overlap them slightly, help make sure that it stays and help protect the skin. So what you're going to do is lay the Leuko tape down. You're going to pinch and gather the skin and then lay it down. You don't want to pull too hard because this tape doesn't have much give, so pinching and gathering it really helps it inhibit the muscle. So then have them contract again. Good. And yeah, that's this tape job. So this is the TMR, which stands for Total Motion Release, Fab 5. So what you do is you have the patient or the athlete do 5 motions and see if there's any discrepancies when comparing sides. So the first thing you're going to do is shoulder flexion. So you have the athlete flex their arm as far as they can and see if there's any pain or limited motion. And then do that on the other side to compare bilaterally. And then let's just say that there was pain or difference in motion between sides. You would have them do the motion on the arm that isn't affected. So let's say that JT's right arm is not the affected side, so he would do shoulder flexion for about 15 repetitions, and then he would check and see how his other side compares, and often you will find increased motion. The next one is going to be trunk rotation. So you have the patient cross their arms and rotate to one side as far as they can, and then rotate to the other side as far as they can. So if there's a discrepancy, there's a couple different things you can do. The first one is going to be, let's just say there was a discrepancy on the right side and he could not rotate to the right as well. So you'd have JT rotate to the left and do 20 repetitions, 3 sets of 20 repetitions or 4 sets, depending on how bad it was. And then after that was completed, he would rotate to the side of the discrepancy, and there should be increased rotation. Another thing you can do is have them cross their arms and rotate as far as they can, having their eyes start the movement. and hold for 20 seconds. And do that for 5 different sets. The third one that we're gonna do is a single leg stance while sitting at the end of the chair. So JT is gonna sit at the end of the chair and then try to stand up using one leg. Have him sit back down and do it on the opposite side. So if JT struggled getting up from the right side, you would have him get up using the left leg and have him do that 15 times, 3 sets, and then he would go back to the other leg that was affected, and it should be much easier to do. The next one is going to be the single leg raise. So while sitting at the end of the seat, JT is going to extend his knee and lift his leg, and you're going to do that on both sides. And if there's a discrepancy, JT will do that motion on the unaffected side. So let's say that it's the right side that's affected, the left limb will be extended 3 sets of 15, and then do it back on the other side, and there should be improved motion. The next thing is going to be, while standing, a single leg squat while the heel is sliding across. So he's going to tap his heel forward and see if there's a difference in how far away his heel is on either side. So if there was a main difference, you would have JT go on the unaffected side and do the motion 3 sets of 15. So let's say his right leg is affected. On the left leg, he would do the heel slide. Perfect. Again, 3 sets of 15, and then go back to the affected side, and there should be a difference in motion. And that is the Fab 5 technique.